Thanks, Good. Okay, we're very honoured tonight to have the chair of the Vancouver Island University History Department, Katherine Rollwagen, whichever way you want to pronounce it. And just a bit of background, which I got off, I guess, the VIU website. So Katherine comes well educated, as you might expect, for a VIU prof, with a BA and MA from the University of Victoria. And then she went to Ottawa to do her PhD. And also, after that, I gathered a couple of years at McMaster.
1 year, yeah.
1 year, yeah. So then 2014, that's when Katherine came to Nanaimo, joined the staff at VIU. And Katherine, it's a project that the students did a couple of years ago. And apparently, I didn't see it, but apparently it was on display at the Nanaimo Museum. So maybe some of you have already seen it. If not, we're going to hear all about it tonight. So with that, I'd like you to join me in welcoming Katherine to the podium, where she's going to be talking about the Spanish flu epidemic in Nanaimo, 1918 to 1920.
Thank you very much, Ted. What do I need to do to get the projector to start again? It's just sleeping.
I put the blinkers
Oh,
on.
you put the blinker on. So we can have the big reveal, maybe. Uh-oh, it's okay. It's probably just gone to sleep. It probably just needs a little poke.
One of the people we're looking for is an AV assistant.
To be fair, we did ask someone, but he wasn't able to come tonight. So that's unfortunate. Oh, it's coming. I see it just needs a moment.
Can we get somebody that turns part of the lights out? Well, I just tried that and they all went out, so, okay.
We'll be,
In the other room
we can be a bit more.
part of it.
We should be all right.
Dark, but then I don't have, I need light for the video, but
Yes.
then that's kind of been done separately, so that's okay.
Is that a separate? A magic light? Oh, that's a mystery light switch.
You turn that one on and just leave the
Okay,
bathroom light.
that's good.
You can see it pretty well.
It's good? Okay, thank you, Dallas. The contrast is, I am terrible. You can ask my students. Sometimes my slides give no regard to the human eye and its ability to see contrast. So, oh, that's not so bad. All right, everyone just mind your feet if you need to leave your seat. Okay, so good evening, and I can see my notes, so that's good. Good evening. My name is Katherine Rollwagen. I want to say Eitskwel. I'm trying Eitskwel, and Heitschka Siem Sieu Much Mistimach, which means thank you, respected ones of this place. I'm a descendant of Scottish, Irish, and German settlers to Canada and Australia in the 19th century, and I grew up not here, but on the traditional territory of the Mississauga of the Credit First Nation and the Haudenosaunee and Wendat peoples of southern Ontario. And for the past 10 years...
Could you use the microphone, please?
Oh yes, I can. It's actually on. I'm just not... It just might not be picking up my voice very well. Is that better?
Can you do the hand one that?
I can do the hand one. That might be easier.
Yeah, we have two of the ones here, actually.
Oh, perfect.
Try that one.
Is that good? Oh yeah. That's good. Whoa. That's good. So for the past 10 years, as Ted pointed out, I have lived as a grateful but uninvited guest on the territory of the Nanaimo First Nation. The fall of 1918 was a difficult one in Nanaimo, as it was for many people in British Columbia and in Canada, not to mention much of the Western world. The hub city had been at war since September of 1914 and had lost many young men. Between August and November of 1918, Canadian troops participated in a series of intense battles in Western Europe with many casualties. On the morning of September 10th, a faulty elevator killed 16 miners descending the shaft on Protection Island, leaving 12 widows and 42 orphans without fathers. Now, accidents were not uncommon in the coal mines, but this one hit particularly hard because it was caused when the elevator hoist cable of a not that old elevator snapped. So it was a very unusual accident. And then in October, people began to get sick. The Spanish flu had arrived. This influenza pandemic swept the globe in 1918 and 1919 and left death and misery in its wake. In Nanaimo, it killed more than 50 people, as far as we can tell, in the fall of 1918 alone, infected hundreds more, and affected everyone in the city. 100 years later, a group of history students at Vancouver Island University set out to assemble as many fragments of the story of Nanaimo's Spanish flu experience as they could find in 2 months. We were constrained by the parameters of the term. And to create, with guidance and assistance, an exhibit at the Nanaimo Museum. The result was The Forgotten Flu, the Spanish influenza pandemic in Nanaimo, 1918, which was the name of the exhibit that was installed at the Community Gallery from December 2018 until February of 2019. Yep, there we go. So before I tell you more about Nanaimo's experience with the Spanish flu, 2 things. First, as some of you already know, I am not a historian of public health or medicine. That's my caveat. My research is actually focused on the commercialization of children's culture and media in 20th century Canada. And today I'm presenting as someone who teaches public history and believes strongly in bringing my students into the archives, museums, and other places where we examine and remember our pasts. Speaking of those archives and museums, The Forgotten Flu was a collaborative effort only made possible with the cooperation and assistance of the Nanaimo Museum and the community archives. So the curator at the community archives, Amy Greenaway, the exhibit technician, Jordan John, as well as our amazing archivist, Christine Munzner, gave their time and experience generously over the months of this project, helping the students. And of course, most importantly, a debt of gratitude to the students of History 480, Public History. They gathered the information from numerous sources and then decided how to craft their findings into a narrative for a particular audience. So, what was the Spanish flu pandemic? In the past few years, many of us have become more familiar with the 1918 pandemic. Certainly much more familiar than the students were in the fall of 2018. In many ways, the Spanish flu was a forgotten pandemic, and that's why we chose that title, likely overlooked in the eagerness of the 1920s to commemorate the war dead, and never included among the important events of the 1900s in school textbooks or public commemorations. Of course, the COVID-19 pandemic has now renewed a more widespread interest and awareness of this earlier 20th century pandemic. Influenza was a common disease in the early 20th century. It was seasonal, it was often called the grippe, or it had other names, and it tended to affect the very young and the most elderly most severely, particularly when it led to pneumonia. The flu that emerged in 1918 was different in a couple of ways that I will mention in a few minutes. The first newspaper reports, or the first newspapers to report the high numbers of deaths from influenza in 1918 were Spanish newspapers. And this was because, as a neutral party during the First World War, Spain was not actually censoring its news. Other European countries engaged in the war were either withholding information about the flu, or they were simply too busy with the war and its coverage to pay close attention to the early signs of the epidemic and report these signs in their newspapers. Since it appeared to start in Spain, it was initially labeled the Spanish flu, which became a useful but ultimately inaccurate shorthand. It wasn't until 1997 that the influenza strain responsible for the pandemic was identified as a variant of an H1N1 virus, likely of avian origin. It first emerged not in Spain, but in the American Midwest in the late winter of 1918. The first cases were reported in the army bases of Kansas and Georgia, where large numbers of men recently, because the Americans had recently joined the war, were gathering for deployment overseas. The flu spread to Europe aboard troop ships full of American soldiers bound for the front in the spring, and spread through Europe eastward, traveling as far as Australia by July. At some point after its arrival in Europe, the virus mutated. And chaos ensued. The new variant was much more deadly. It moved quickly along military and commercial transport routes, appearing in West Africa and in Brest, France at about the same time. Brest, which is on kind of the west coast where that number 1 is, it's right about up there somewhere. Yeah, up there, was the main embarkation point for the American Army. Ships traveled from Brest to the US regularly, and the flu traveled back across the Atlantic as well. Those traveling to the front further east took it with them as well. By October, the virus had reached all of Europe, Africa, North and South America, Asia, and South Asia, and Australia. Basically, it's a pandemic. There was a further third wave of the virus in February of 1919. So that's what the 1s, 2s, and 3s, kind of tracing where the waves were. There's some interesting theories, this is kind of a divergence, but there's some interesting theories about how the flu, when it infected soldiers on the Eastern Front, potentially altered the course of the war, how it might have impacted the strength of not only the Allied soldiers, but also the German soldiers as well. Some estimates put the number of deaths due to the Spanish flu at 30 million people worldwide in 1918 and 1919. And some estimates are as high as 100 million. It is believed to have killed at least 50,000 Canadians and was the deadliest epidemic since the Black Death of the 14th century. It killed more people than the First World War, the conflict itself, and its impact was felt on every continent, and we now know for generations. So this was the basic information about the Spanish flu that I shared with students as they began their work in September of 2018. Armed with this knowledge of the pandemic, students began to try and find out as much as they could about the local consequences of this very global event. We made an initial trip to the Nanaimo Museum so the students could hear about exhibit development from Amy Greenaway, the curator, who helped the students start to think about the story they might want to tell and the way to tell it to museum visitors rather than to their university professors, their usual audience. This was a valuable introduction to one of the key concepts of public history, which is thinking about your audience. Who would visit the exhibit? How much information could they actually take in during a visit? How could we help them connect to this topic, and what message did we want them to take away? So this picture was taken that afternoon as they're thinking about those questions. The students quickly identified several types of sources that might be connected to the local experience of the Spanish flu, including newspapers, the records of health officials, personal diaries and correspondence, photographs, death records, and the census. This was an ambitious wish list that definitely shrunk as students came to grips with our limited time and resources. The story in the final exhibit came mainly from the island's many newspapers, as well as photographs, death certificates, and the City of Nanaimo's corporate administration funds, which are housed at the community archives. The students divided research tasks among themselves. Several people were needed to comb through the Nanaimo Daily Free Press, which was just in the process of being digitized. And so they had the wonderful experience of using microfilm machines. So that took a couple people. Another focus on the Victoria Colonist newspaper. Several students made repeated trips to the community archives to search the city records, while another student searched the museum collection. One student focused solely on photographs from various sources, and another focused on death records and the census to try to track down the names of local flu victims. Each student produced a detailed research report, and by reading each other's reports, they began to assemble a timeline of events related to the flu in Nanaimo. So news of the flu reached Nanaimo long before the virus arrived. In late September, the Victoria Colonist delivered a warning from the Victoria City's medical health officer, Dr. A.G. Price, which said Victorians should, quote, guard themselves against the disease, and noted that there were suspicions that the flu had been brought over by men landed from German U-boats. So there was a conspiracy. The newspaper article advised readers to avoid crowds and cover their coughs and sneezes. This was on Thursday, September 26th. There were flu cases in Victoria and Cowichan several weeks before they were reported in Nanaimo. On October 8th, Nanaimo officials received a telegram from the Provincial Board of Health urging the city to close all public meeting places in order to prevent the spread of the flu. Cases and deaths were on the rise by this point in Victoria and Vancouver. And you can see here a total of 23 cases of Spanish influenza reported in the Nanaimo Free Press. This was on October 10th, so only 2 days later. It would be those are cases in Vancouver, right? 23 cases in Vancouver on October 10th. Because it would be another week, October 14th, before the first case was reported in Nanaimo. And the mayor, Henry Mackenzie, agreed to close public buildings and prohibit gatherings the following day, right about this time of year. The closures were announced in the newspaper on October 16th, alongside further articles about the flu in Vancouver and Toronto. All public spaces, including schools, churches, theaters, dance halls, pool rooms, and union or social clubs, were ordered to close. Public auctions, sports events, and community group meetings were all canceled at this point. And they were announced in the newspaper here. I have this here, but I also brought some of the panels that we used in the exhibit. So at the back of the room, there is a reproduction, I believe it's of this page, but it might not be this one, at the back of the room for you to look at later if you'd like. At Quesnel School, teacher Alma A. Roa recorded the school's closure in her attendance register, which the students found in the Nanaimo School Pupil Registry at the archives. And I'll just show you that. I do have this at the back of the room, and you're welcome to take a closer look at it. All the students' names are listed. You can see that she took attendance every day. The dates are across the top. And then when you reach October 16th, there's no more X's, just the words epidemic of Spanish influenza. Nanaimo reported its first flu-related death on October 18th. And this was the death of Mrs. Philip Frenchy, who lived on the Nanaimo Reserve. She was 78 years of age. The number of cases in Nanaimo increased rapidly, and within just a few days, hundreds of people were ill, and 36 were in the Nanaimo hospital. And this is a photograph of the hospital at the time. Crowding at the hospital led authorities to turn the nurses' home next door to the hospital into a temporary ward for the most serious cases. Large tents were set up on the hospital grounds in case of a sudden influx of patients. This image of the hospital on McCleary Street was taken just before the war and gives us a good idea of where those tents would have been on the lawns. The Board of Health decided to convert the athletic club into a temporary emergency hospital, dedicated to flu patients. At this point, 2 local doctors were reported in the newspapers to be ill, and the hospital began recruiting volunteer nurses to assist with extra care labors. The newspaper reported that the Western Fuel Company was using its ambulances to transport people to hospital. On October 26th, the newspaper reported that Alberta was now requiring all people to wear masks in public places. Alberta was, I believe, the only province to institute a mask mandate. In Vancouver, people were also encouraged to wear masks, but it was not required. The regulated mask was typically made out of gauze or linen and could be soaked with disinfecting concoctions such as carbolic acid or bichloride of mercury, chemicals we now know to be quite toxic. The students found that quite fascinating. In Nanaimo, city officials did not want to require mask wearing without asking the provincial government first. Mayor Mackenzie appealed to the government in Victoria to enact province-wide laws and regulations, arguing that a city law would not be very effective. Like today, Nanaimo was a hub for travelers to and from Vancouver Island. Ferries did not stop traveling back and forth, as far as we could figure, during this time, and the train made daily trips up and down the island throughout the pandemic. Mackenzie believed that a province-wide order for masks or a complete travel ban would be the best way to prevent the spread of the flu. The provincial government did neither. When the emergency hospital opened in the athletic club on Saturday, October 27th, patients quickly filled its 36 beds. While the newspaper stated several times that the worst seemed to be over, and we found repeated references, oh, the worst is behind us, it's behind us, and new cases did appear to be less severe, the newspaper also noted that it was, quote, impossible to state from one hour to the next how the malady will affect those stricken with it. Overall, the newspaper seemed to want to minimize panic in the local population. It said, anxiety and worry will do more to render a person prone to become infected than any other 2 causes. And since there is actually no cause for excessive alarm, much less for any panicky feeling, a calm and dispassionate view of the situation should be cultivated by all. Keep calm, carry on. The front page of the Free Press on October 26th illustrates how the epidemic was competing for attention with other global events. The war and the Russian Revolution often pushed reports about the flu off the front page. When the armistice was signed on November 11th, the newspaper reported that Nanaimoites would gather. This is the front page, war is over. Nanaimoites could gather downtown at 7 p.m. on November 11th for a torch procession and speeches to mark the occasion. There was no mention of the ban on public gathering, or indeed of the flu at all. But the obituaries from the same day reveal several recent victims. The flu was not typically mentioned in these obituaries, but if the death happened in the emergency hospital, then that was typically the cause of death. Deaths continued to be noted in the newspaper throughout November, and the majority of Nanaimo's flu victims actually died in that month. But by the end of the month, the number of new cases was considered low enough that the city applied to the Provincial Board of Health to reopen public meeting spaces at the end of November. I find the case of the Shaw family. Maggie Shaw, age 12, passed away Saturday night at the home of her father. George Shaw, who had already lost his wife to the epidemic during the first few days of the month. And this was quite typical, a typical case. So schools reopened in early December. Pardon me. Schools reopened in early December, and while there was an increasing number of flu cases again in February 1919 across Vancouver Island, the city decided to lift the last preventative measures it had put in place which was a ban on dancing. So that was the last ban to be lifted, was the ban on dancing in February of 1919. Over a period of 4 weeks, the students uncovered a wealth of names, dates, events, photographs, advertisements, posters, telegrams, obituaries, and material artifacts. The group then had to move quickly to decide what parts of this story to tell. What would be the most informative and also the most interesting for museum visitors? The decision was made to focus on as many local individuals as we could, to put as many Nanaimo faces to the story as possible. So all of these photographs were used in the exhibit. On your left, Dr. W.F. Drysdale was Nanaimo's medical health officer, and so a position of power during, well, at any point, but particularly at this time. He met regularly with the mayor during the pandemic and corresponded with provincial authorities in Victoria to determine when the ban on gatherings could be lifted. His letter to the mayor on October 14th, which recommended against stopping public gatherings, demonstrates how quickly the situation changed, because the mayor banned public gatherings only 2 days later. So that sense that no one is really sure what should happen or how quickly was evident to the students. Dr. J. Ingram, who's a little bit harder to see because he's in a group shot, was also someone whose name appeared in the newspapers and who the students were able to locate in a photograph. He's on the bottom left of this photograph. Dr. Ingram worked in the hospital during the pandemic and was also infected with the flu, but recovered. Joseph Sutton, whose name now graces one of our parks, was a local miner who volunteered during the pandemic. And the Red Cross actually awarded medals to some of these volunteers, including Joseph Sutton, whose medal is part of the Nanaimo Museum collection. And it's a Red Cross medal, and on the back it says Spanish flu volunteer. And it was displayed as part of the exhibit. So these men, whose names we don't know, usually drove the ambulance that belonged to the Western Fuel Company. So the company would have used it in the case of industrial accident, workplace accident, but they were conscripted into service ferrying flu patients to the hospital and to the emergency hospital during the pandemic. The students also wanted to try to figure out, how many local victims of the flu there were. And this was a kind of historical investigative exercise that they very much enjoyed. Was the flu worse in Nanaimo than it was in other places? Using digitized death certificates from the BC archives alongside genealogy records available on familysearch.org and flu victims named in the newspapers, students identified nearly 50 individuals who died in October or November. And their list only included people whose cause of death was listed as influenza or pneumonia, which was a common cause of death following flu infection. Multiple deaths in the same family was another clue that they sometimes used to figure out, potentially this family might have had the flu. The total that they found is likely conservative because it doesn't include December or the early months of 1919. They really focused just on October and November. The students used the information that they gathered to demonstrate that the pandemic did follow similar patterns in Nanaimo that it followed elsewhere. Healthy adults in their 20s and 30s were particularly susceptible to this virus. In Nanaimo, we found victims as young as 2 and as old as 78, but at least 20, or nearly half, were in their 20s and 30s. They also calculated, the students, an approximate mortality rate, discovering that Nanaimo's deaths per 1,000 people was nearly the same as Vancouver's, higher than the provinces and the countries, and double the mortality rate in Seattle, where masks, again, were mandated. Compiling the names and information of flu victims revealed the pandemic's tragic consequences for many local families. One father on the Nanaimo Reserve lost 4 children in 6 days. George Shaw's wife and 12-year-old, as we saw in that obituary, both died. The death of Grace Gibson, a 37-year-old teacher at Middle Ward School, was noted in the Victoria Colonist. She contracted the flu after volunteering as a cook at the emergency hospital. Miss Florence Pearson was a British-born nurse who was made the matron of the emergency hospital when it opened in late October, and she succumbed to the flu in early November. Her obituary in the Free Press called her a martyr to duty. The students also identified 6 married couples who died within days of each other, and estimated that at least 18 children were orphaned in this short time. Students acknowledged that finding out more about these people would definitely help to bring the events of October and November of 1918 to life for museum visitors. But their desire to tell these stories quickly came up against the realities of exhibit design. There wasn't the space to talk about all of these victims unless they opted for a memorial-style list, which of course might be less meaningful. They decided to select one example to illustrate the broader trends of infection and mortality. There were several of these families to choose from, but after a rich discussion, we decided not to spotlight any of the families from the Nanaimo Reserve, despite the fact that Indigenous people were more likely to become sick and die of the flu. The students felt, and I agreed, that telling those stories required a collaboration with the Nanaimo, a relationship we did not have at that time. The Ketchin family was selected in part because the students had found an image of Annie and Thomas Ketchin. And of course, in a museum exhibit, images are important. They were able to find additional information about them in the census. Thomas came to Nanaimo in 1911 from Glasgow, Scotland, with his parents. And once in Nanaimo, he married Annie Jane Duggan. Annie was born in British Columbia and was living in Northfield, where her mother kept a boarding house. After they married, Thomas and Annie had one daughter named Mildred, and they were both in their late 20s when they succumbed to the flu, dying within days of each other in October of 1918. 7-year-old Mildred survived, and after her parents' death, went to live with her grandmother, Mary Louisa Duggan, in Northfield. So this story allowed the students to point out some of the common characteristics of flu victims, the way in which it tended to infect people in the prime of their life, for example, the way in which multiple parents were often victims. It highlighted all of those things. The group was also interested in the public health messaging during the epidemic and remarked several times that the prevention and treatment of influenza had changed little over 100 years. This was, again, before COVID. Students found a pamphlet in the BC Archives collection. And apparently there was one right here. They found a pamphlet in the BC Studies collection that was prepared by the Nanaimo Board of Health to inform residents about this flu. It explained that flu was caused by 2 germs, pneumococci and streptococci, which produce a poison in the blood. Readers were warned, this is no common gripe, thank you. I don't know, it sounds right. Yeah, I don't want to grip. You're in its grip. I don't want to gripe. I took French immersion, so I just want to say gripe. So this is no common gripe. It is a violent epidemic, and in some forms a deadly plague. Let doctors, nurses, ministers, and undertakers tell you how dangerous it is. Listed among the best preventative measures are several things that we would find very familiar. Avoid the other fellow's breath. Be unsociable for a change. Spray your mouth and nose several times a day. Don't use the mercury. Probably with like a soda or something slightly acerbic. Carbolic acid, probably, yeah. When near an infected person, wear a mask. Moisten the mask occasionally, again, carbolic acid. Isolate the patient. Use disinfectant freely. Funerals must be strictly private. Those infected were instructed to go to bed at once, to take hot drinks and aspirin or acetaminophen, eat liquid foods, and get plenty of fresh air. Call for the doctor, and be slow to get up. At the bottom, in capital letters, was the reminder. At the bottom was the reminder that the courageous, cheerful mind is a splendid medicine. Students also wanted to include some of the treatments and preventative measures that were advertised in the Free Press. Local druggist A.C. Van Houten offered pills for the grip, throat sprays, and bronchial lozenges in this ad that appeared for antiseptics. It appeared regularly during the pandemic. Outfitter Harvey Murphy on Commercial Street sold sweaters, coats, and warm underwear to boys and men as a common sense precaution against the flu. Makers of medicinal tonics capitalized on the unknown aspects of the disease to promote their products. So once the elements of the story were in place, the students decided as a group how to convey this story in the most effective manner. This meant considering all the things that we kind of take for granted when we visit a museum. How much text will people read? What colors will work best? Which photographs will be effective? Which do we have permission to use? They each created an exhibit design for Amy and Jordan to comment on, and we settled on a final panel layout. Once again, the students took on different tasks to bring the exhibit to life. Some were writers and editors, others worked on the layout, one created the poster, another wrote several promotional texts to be used by the museum to promote the exhibit. And pictured here, several helped to prepare and hang the panels in the exhibit space. Cheryl and Sora. Students valued the hands-on experience that this project gave them. In becoming co-curators of their own exhibit, they realized the challenges of communicating stories about the past to the public. They realized how much research is needed and how much gets left out in presenting a coherent narrative. And they appreciated how a truly global event could be connected to local people and to the streets that they walked each day. These are some of the words that they shared as part of the museum, kind of reflection on the museum itself. I'm really glad that someone said the most fun was looking at old copies of newspapers on microfilm. Yes. I want to close with one last quote from the Nanaimo Daily Free Press that I thought of often during the first year or so of the COVID-19 pandemic. In an editorial on November 23rd, when cases of the flu were increasing and the worst for Nanaimo was still to come, the editor of the Free Press wrote, "Probably by the time the next epidemic comes around, we will be ready for it. Certainly, the whole world shouldn't be forced to sneeze and sniffle allegiance to certain anonymous germs any longer than is absolutely necessary. We ought to make this the last flu." Thank you very much. I look forward to your questions.
Can we have some light?
Let there be light.
We'll
And it
have
was good.
questions, and when you make questions or comments, can you wait until the mic's with you? That way you will appear on the video.
Or your voice will.
Your voice will.
Okay, who's got the first question? Okay, Daryl.
I've been wondering if the case records indicated that there was any sort of quarantine advantage to being a Gulf Islander or living north of Campbell River, for instance.
So, a couple people, I'm thinking of there's a really good article in BC Studies about the flu in British Columbia generally, and particularly in Indigenous communities. And it's interesting because being remote, we could see that as having an advantage. But if the flu got into a place that was like a Gulf Island, like the North Island, it could be much more. It could spread much more quickly and have more devastating consequences. Yeah. So I don't know about the Gulf Islands. Again, there were so many things.
Gabriola?
Yeah, not even Gabriola. I mean, it wasn't. What's interesting is that it wasn't mentioned in the news. It didn't seem to come out in the newspapers that that there was anything specific or different happening on Gabriola. So I don't know if they had their own facility to quarantine people, or if people were coming to Nanaimo for treatment. It wasn't something that was in the records that we could see. Yeah, that's something that could potentially come out in more oral histories and people remembering, I think, for sure. Yeah.
Thanks.
Yeah.
Got someone else? Over here?
Nope.
I'm very interested in the parallels between a century ago, a little more than a century ago,
Yeah.
and what we've seen in the last couple of years. And in particular, the pushback that we're seeing now and the mistrust of public officials. And was that happening at that time as well?
Well, I think, I mean, my interpretation of some of the newspapers saying, you know, there's no need to panic and everyone should just stay calm, suggests that they were concerned about that. They didn't. I think there was, in some ways, less pushback in the sense that people still, like, we didn't find any evidence of people not going to work, for example. Like the everything, all the employment was full and happening, and no one was being asked to not do their daily job and not get paid, right? So, and there was a war happening at the same time. So I think that in some ways, because the war was happening, there was things going on that kind of people's interests and passions were kind of diverted all over the place. And they didn't have just one thing to think about. They were also thinking about the end of the war and all of that. But I do think there's definitely some kind of hints, at least, you know, public officials are having conversations where they're saying, why isn't Victoria doing this? You know, we could really use some help here, but Victoria wasn't, or the provincial government wasn't willing to do that. And so it kind of hints at it. I know that I think the war mentality also helped in a certain regard, right? That you've had a number of years of people doing what they needed to do, kind of, for king and country, and so that potentially mitigated some of the pushback a little bit. Yeah, it's a tricky thing to get at, right? Because it certainly wasn't something that was coming out in the sources that we were looking at.
Yeah, one other thing I wanted to mention was in the middle of all of, you know, the war, the flu, on the BC coast, the worst maritime disaster in the entire history of the west coast of North America, the sinking of the Princess Sophia, also happened in October of 1918.
Of 1918, right, yeah. So there's another one to add to the list. Thank you.
Whose hand was up first?
Hi, I just wanted to, can you hear me?
Yes.
Yeah. Just wanted to ask you, do you know whether there were long-term effects of the flu the same as this time around? Like, did that get reported at all? And
Not at the time.
Not at the time?
No, yeah. I mean, I know, and again, I'm not an epidemiologist or a doctor, but some of the research that emerged in kind of the last quarter of the 20th century was looking more at the way in which people who survived the flu were more likely to have other health complications later in life. And what they are exactly, I couldn't say, but that it did have an effect, not just at the time of the flu, but over time on people's physical and, I believe, mental health. They've been able to show that over time. Yeah, so the effects were, again, multi-generational.
Yeah, I thought that might be the case. And the people who did die that were in the 20s and 30s, was that related to their workplace?
Oh, because they were working?
They were working age. Yeah.
I think it would have made them potentially more likely to be infected, but it was also that, and again, not a doctor, but it caused that kind of psychokinetic storm where people with healthier immune systems seemed to like their bodies were trying to fight it so much, and that weakened them in some way. So there was a way in which people who were healthier, not only they might have been more likely to be infected because they were working, but also the way that the virus affected them was more severe. This is what people who look at these things have said.
I'm interested in the only time the churches were mentioned was the ministers, to listen to the ministers.
Yes.
Which I thought was interesting when dancing is not allowed.
Yes.
But churches were not part of any of the list you gave. And I just wondered what was the role of the churches in this?
Yeah.
Pray and carry on, maybe?
Right. Well, the churches were listed in the places of public gathering that had to be closed. So,
Specifically, because I wondered.
Yes, schools closed, churches, as well as the dance halls and all the more kind of potentially fun places. Yes, the churches were also closed, and I imagine that the ministers would have continued their work in a more kind of itinerant fashion and going and visiting people, when they could. But yeah, they don't get a lot of mention aside from, listen to them. So clearly there's still authorities on what a good thing to do is, right?
It just seems strange that there's no praying or, even in the present situation, there wasn't that sense that prayer could help.
Yeah, it doesn't come out in the...
Seem that might have been a logic at that time in terms of people's perception of the power of prayer.
Yeah, well, and it may have been in ways that haven't been recorded in very public sources like newspapers. So
but
people
the
weren't...
church archives might have something.
They might, yes. Yeah. They might talk about, or people remembering what they did during the pandemic as well. Yeah.
Thanks.
Thank you.
You have a question?
Yes, please. Oh, thank you. I'm not aware of what their source of information would be for the public at that time. I don't know whether was there radio? I don't know that. No radio.
Nope.
So they wouldn't know what's going on in the rest of the world.
Aside from newspapers.
Aside from newspapers. So the fact that some people
And
are
letters.
being arrested in other areas for not wearing masks in the world, they wouldn't know about that.
No, certainly the speed of information. It wasn't, it was, I don't want to make them sound like they didn't have any access to information, because newspapers were published not just daily, but sometimes twice daily, right? Like the evening edition was like a whole other newspaper.
Where did they get their information, though?
They did have news wires. So, the telegraph machine, and they had centralized, like the Canadian Press or Reuters Today, agencies that collected the news and shared it around. Yeah, for sure. So yeah, they did, like the newspapers are so rich because they're so full of all the sometimes seemingly random things that are happening, as well as the big major events that we now consider to be really significant historically. And certainly reading the newspaper and writing letters to each other is often a way that people wrote a lot of letters. Yeah.
And the postal service was efficient.
It was very efficient.
Any more questions? Going, gone.
Well, thank you, Catherine. Fascinating. The couple of things that got my attention were your maps at the front end, which I've never seen before.
Well, I can tell you where I got them because I didn't make them myself.
No, but that's kind of interesting.
Yeah.
But also the amount of local information that your students managed to collect, which really brings, many of us have stories that in our own families about the impact and so on, but lots of times we don't know what that is in our community, since me anyway, I'm from away, so I'm not tied into the community stories. But I think that's also the case here in town, is that a lot of people knew what happened to them, their own group, but not so much about what happened around them. So thank you very much.
Thank you.
And on behalf of the society.